Wilson disease. Wilson disease is an autosomal recessive condition marked by copper accumulation in the liver, brain, and cornea, which most commonly manifests in childhood, adolescence, or early adulthood with hepatic involvement and/or neuropsychiatric symptoms. Psychiatric symptoms range from subtle personality changes to depression, mania, and/or psychosis. These symptoms may predate hepatic or neurologic manifestations and be mistaken for normal adolescence or primary psychiatric illness. Evaluation includes a ceruloplasmin level, 24-hour urinary copper excretion, and slit lamp examination for copper deposition in the cornea Kayser-Fleischer rings. Pathogenesis of Wilson disease. Autosomal recessive mutation of a TP7B gene. It causes hepatic copper accumulation. Copper leaks from damaged hepatites and deposits in tissues, for example, basal ganglia, cornea. Clinical findings of Wilson disease. Hepatic acute liver failure, chronic hepatitis, cirrhosis. Neurologic Parkinsonism, gait disturbance, dysarthria. Psychiatric depression, personality changes, psychosis. Diagnosis of Wilson disease. Low ceruloplasmin level and high urinary copper excretion. Increased copper content on liver biopsy. Kayser-Fleischer rings on slit lamp examination. Ceruloplasmin is a protein made in your liver. It stores and carries the mineral copper around your body. Treatment of Wilson disease. Chelators, for example, D-penicillamine, Trentine. Zinc interferes with copper absorption. A patient with auditory hallucinations, mood and personality changes associated with neurologic features, slurred speech, tremor, gait instability, and abnormal liver function tests suggest a diagnosis of Wilson disease. Acute intermittent porphyria can present with psychiatric symptoms. However, these are episodic in nature and normally associated with abdominal pain and peripheral neuropathy. Acute intermittent porphyria commonly manifests in midlife rather than childhood. Heavy alcohol use can result in elevated transaminases and psychiatric symptoms, and acute intoxication can present with slurred speech and unsteady gait. However, acute intoxication would likely present with stupor or disinhibition, alcohol on the breath, and additional findings such as abnormal vital signs, for example, hypotension, tachycardia, or other metabolic abnormalities, for example, hypoglycemia, hyperlactatemia. Tremors would be expected in alcohol withdrawal, not intoxication. In hemochromatosis, there is an abnormal buildup of iron, which particularly affects the liver, heart, and pancreas. It may present with abnormal liver function tests, diabetes, arthralgia, and/or cardiomegaly. Hemochromatosis tends to present in later life, for example, age greater than 40. Neurologic findings and psychosis are uncommon. Wilson disease is associated with copper accumulation in the liver, brain, and cornea. It can present in childhood or adolescence with abnormal liver function tests and/or neuropsychiatric symptoms. Psychiatric symptoms may predate other manifestations and include personality changes, depression, mania, and/or psychosis.